Welcome to Temporary Foreign Workers Health and Wellness. This webinar is part of our Health and the Mobile Workforce webinar series. We're happy you were able to join us. My name is Yusra Benjeloun, Administrative Coordinator and Projects Manager with the Work Wellness and Disability Prevention Institute, and I'll be co-moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program, through the BC government, as well as donations and memberships to WWDPI. We thank our program partners, Canadian Council on Rehabilitation and Work, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website about a week after the live webinar, along with the slides. You will be emailed the direct links for all of these items when they're available. Today's webinar will be co-moderated by Dr. Barb Neese, Project Director at the On the Move Partnership at the Memorial University of Newfoundland, and I will let her introduce our Q&A discussant, Santiago Escobar, and our presenters, Dr. Dalia Gesualdi-Fecto and Dr. Adam Perry.
Thanks very much, Yusra, and welcome everyone to the second in a series of 3 webinars co-sponsored by WWDPI and the On the Move Partnership. The On the Move Partnership is a national program of research on extended mobility for work in the Canadian context. Now in its 8th year, On the Move has been documenting diverse mobility patterns across multiple sectors, the drivers for these, and their consequences for employers, workers and their families, and home and host communities. The title of today's webinar is Temporary Foreign Workers, Health and Wellness. We'll start with a joint presentation by 2 On the Move co-investigators, Dalia Gesualdi-Fecto and Adam Perry. Dalia is a member of the Quebec Bar, a professor with the Faculty of Political Science and Law at the University of Quebec at Montreal, and a researcher with the Inter-University Research Centre on Globalization and Work. Dalia leads a hub on the human and financial costs of access to justice through the Accessing Law and Justice Consortium, and among other things, her recent publications focus on the realities of temporary foreign workers, labor inspection, and work time boundaries. Adam Perry is currently Assistant Professor of Adult Education at St. Francis Xavier University. Adam's work draws on his experience as an advocate for migrant worker justice, and particularly on his several years as a volunteer community worker with migrant farm workers in Leamington, Ontario, as well as on his current research on internal migration within Canada among low-skilled temporary foreign workers. And we're very fortunate on this webinar to have a discussant as well. Our discussant is Santiago Escobar. Santiago is a national representative with the United Food and Commercial Workers, and in collaboration with the Agricultural Workers Alliance, the UFCW Canada operates a national, on-the-ground network of worker support centres with staff and volunteers, helping thousands of migrant workers to navigate and enforce their current legal rights, such as access to collective bargaining and entitlements, as well as providing health and safety and know your rights training. Dalia, over to you.
Thank you very much, Barb. Adam and I are very happy to be here today, and we thank you for joining us on this webinar. So some of you might have participated in the webinar presented by our colleagues, Catherine Littell and Dina House, that touched on issues of mobilities and workers' compensation. So just as a matter of background, I'd like to say that employment-related geographical mobility can lead to better jobs for workers and to an improvement in family income, but research also suggests that extended employment-related geographical mobility often has negative impacts on workers' physical and mental health. Some studies have highlighted the significant link between mobility and cardiovascular risk, transport injuries and fatalities, as well as occupational injury and illness. If this is true for several categories of mobile workers, the fact that temporary foreign workers have a precarious citizenship status can add additional layers of vulnerabilities that are likely to have repercussions on their health and wellness. Figures: since 2006, the number of workers with a temporary work permit has increased over 60% in Canada. Workers with a temporary working permit are employed in a variety of sectors, as those from the agricultural and food processing sector to very specialized positions, for instance, in the aerospace sector. In 2015, over 150,000 temporary foreign workers held work permits in Canada. More than 45,000 of those were seasonal agricultural workers, and we would like to mention that from 2006 to 2015, the number of seasonal agricultural workers almost doubled in Canada. As we will see, temporary foreign worker programs predetermine several conditions with which workers have no choice but to cope, and several have documented that these workers are at higher risk of experiencing negative health and wellness effects. In today's webinar, we will discuss the socio-legal context around which health and wellness risks are experienced for temporary foreign workers, and we will focus on low-wage workers who generally are less likely to transit from a precarious status to a permanent status in Canada. Okay, just for a little overview, in Canada, temporary foreign workers will come through two main pathways. The first being the Seasonal Agricultural Worker Program, and the second being the Temporary Foreign Worker Program. The Seasonal Agricultural Worker Program was put into place in 1966 when Canada switched its immigration system to one that was points-based. Officially, this points-based system was to make the criteria for evaluating an immigrant's candidacy more explicit and to give way to a better framework to administrative discretion. Nevertheless, this system will give almost absolute precedence to skilled and educated immigrants. The Seasonal Agricultural Worker Program is a bilateral interstate program allowing employers to meet their labor requirement by recruiting seasonal agricultural workers for a limited and predetermined period of time. The Seasonal Agricultural Worker Program, which was first between Jamaica and Canada, was later extended to Barbados and Trinidad and Tobago in 1967, and then to Mexico in 1974. Still to this day, the maximum length of stay for workers under the Seasonal Agricultural Worker Program is of 8 months. The Temporary Foreign Worker Program was introduced in 2002. Employers from various industries and sectors may resort to the Temporary Foreign Worker Program. Like it's the case for the Seasonal Agricultural Worker Program, workers will come to Canada to work for a predetermined employer and for a limited period of time. The maximum length of stay under the Temporary Foreign Worker Program is rather 24 months. Important to say also that there's 3 main streams under which workers can come through this program. The high wage stream, when the employer is offering a wage that is above the provincial median hourly wage. The low wage stream, if the employer is offering a wage that is below the provincial median hourly wage. And the agricultural stream, the third stream of this program, that will allow agricultural employers to hire agricultural workers that come from a variety of countries. So essentially, employers will be able to hire agricultural workers through the Seasonal Agricultural Worker Program, but also through the agricultural stream of the Temporary Foreign Worker Program. Although these programs have undergone a significant successive changes over the years, the principles that are governing their implementation have not changed much over the years. The various temporary migration programs have different common denominators. Employers that wish to employ temporary foreign workers must receive a positive labor market impact assessment from the federal authorities. What does that mean concretely? Is that to receive a positive, what we call an LMIA, or labor market impact assessment, employers must demonstrate that they made reasonable efforts to hire locally. Local recruitment practice will be deemed acceptable if employers posted a job for a 4 week period with no success. What does that mean concretely is that temporary foreign workers can only be hired by employers who have received a positive labor market impact assessment. The employment can thus only be initiated by the employer. The length of their employer and their stay in Canada is of a limited period of time and will also be predetermined in advance. So when we talk about precarious citizenship status, what do we mean? What are the consequences of having a precarious citizenship status? A precarious citizenship status means that a person cannot enjoy the full benefits of a permanent status in Canada. Workers that are deprived of a permanent status have very little professional mobility inside the Canadian labor market. They cannot change employer as they want unless they are hired by an employer who has a positive labor market impact assessment and that they obtained a modified work permit. Workers are constantly subject to deportation, and Adam will come back to that shortly. Lastly, a person's migratory status will determine the scope of access to different social rights, including the right to education and health. So before going further, Adam and I thought of giving you an overview or a quick idea of our personal connection to this topic. So for my part, between 2004 and 2012, I was a labor lawyer, and my practice in Montreal, Quebec, was devoted at representing non-union workers who complained about violations to their basic labor rights. It was in that period of time that we saw the first complaints from seasonal workers come through in Quebec. These complaints were channeled through community and advocacy groups, often supported by UFCW. Throughout the years as a lawyer, and later throughout my research, I came to witness different situations where the health of temporary foreign workers was likely to be impaired, often because workers were not inclined to voice some violations to their basic labor rights, or because the conditions set forth by the Temporary Foreign Worker Program or the Seasonal Agricultural Worker Program was likely to push them to work to an extent that would jeopardize their health. One case especially struck me. A worker I met had specific financial goals that he wished to reach during the course of his stay in Canada. As mentioned, temporary foreign workers are allowed to work in Canada for a predetermined period, after which they're expected to go back home. This worker was employed in a farm for a period of time of 5 months. To reach his financial goal, this worker had to work up to 65 hours a week. His days were long, and he often accepted to skip his weekly rest. Given the repetitive nature of his tasks, the worker had developed musculoskeletal disorders on both his wrists. He knew this was happening, but had decided to self-medicate himself with painkillers that he had brought from Guatemala, which he mixed with energy drinks. The self-medication practice is very, very common among temporary foreign workers. Midway through the season, both his wrists were crushed, and he had no other choice than to stop working. Even though he had consulted with a physician, the claim was never filed with Quebec Workers' Compensation Board, and the following season, he found out that his previous employer did not wish to rehire him. The doctors considered his wrists were permanently impaired and that he was no longer fitted to do the task. The story of this worker shows how the precarious migratory status of workers, coupled with their fixed-term employment and the socio-economic background from which many low-wage workers come from, generate dynamics that are likely to impair their health and even their actual capability to work. On to you, Adam.
Thank you, Dalia, and thank you to everyone participating today in the webinar. So my academic curiosity in the area of temporary foreign workers started from my work as an advocate working with migrant farm workers in Southern Ontario. This was about 15 years ago. I spent 3 consecutive agricultural seasons as a community worker and volunteer. I volunteered for an organization called Frontier College, which at the time was placing volunteers directly on farms to support workers with learner-centered adult education programs, which meant that I worked with interested workers to create their own learning plans, mostly in the areas of English as an additional language. At the time, I was working exclusively with Mexican and migrant workers, and as Barb mentioned, in my own research, I've gone on to work with other temporary foreign workers from other countries in low-wage jobs outside of agriculture as well. Inevitably, many of the lessons that I did at the time focused on health, with a particular interest among workers on how to communicate with healthcare workers and healthcare providers. I spent months helping workers to express their pain and to explain various symptoms to doctors and nurses. And for workers not being able to express themselves about their health concerns because of the linguistic barriers between Spanish and English felt like a basic indignity. Whenever they did go to the hospital with a complaint, there was a sense among workers that they were not understood, or even that they weren't believed. Most workers' complaints were not visible, and as such required detailed and nuanced descriptions of feeling, such as musculoskeletal and gastrointestinal complaints, which together comprise nearly half of all complaints. And that is a stat from OCAL, who I'll come back to in a minute. So not having the ability to communicate directly with a healthcare professional can thus diminish the quality of care. I was eventually asked to help translate for workers at the local hospital in Leamington, and the triage nurse would often call if a UFCW representative was not available. Now, at the time, my Spanish was very fragmented, and I'm not really sure how much of a help I was, but there wasn't much else available. And it was also having me there in between the doctor or the nurse and the worker was also, I feel, a major breach of privacy for both parties. In my final year in Leamington, I worked as a volunteer coordinator with the Frontier College Worker Support Center, where I organized English as a second language classes. One particular evening, a volunteer tutor came to me because she was worried about one of her students who didn't show up for class. So this was a particular student who never missed a day. After some searching around through his friend networks, we came to learn that he was hit by a car while riding his bicycle to class. He was rushed to Windsor and had to have multiple surgeries, and he eventually was repatriated to Mexico and was never returned to Canada. Well, this was the only worker that I knew personally that was hit by a car while traveling to town. It is unfortunately a common occurrence on the roads and secondary highways in areas with a lot of migrant farm workers, not just in Ontario, but elsewhere. So what led to me to my subsequent work as an academic and continue work as an advocate is to really try to find ways to make sense of these kinds of situations. So why was a random non-Spanish speaking volunteer like me being asked to translate the most intimate conversations between these men and their healthcare providers in a small regional hospital? And why were Ontario's roads so dangerous for my friends and my students? And I'll say that my area of research has not explicitly been related to health all the time per se, but when you work in the world of migrant workers, the issue of health is never far from the forefront. And I'll mention that for those of you who are interested, there are some really important initiatives that have been undertaken in Ontario specifically, and likely in other areas as well. The Occupational Health Clinics for Ontario Workers, otherwise known as OCAL, has a migrant worker farm project in southwestern Ontario, which is a coalition that brings together advocates and healthcare practitioners to provide healthcare clinics to workers that are accessible in the areas where they live. And from a linguistic point of view, they do provide services in Spanish in places such as Simcoe, Ontario, and Leamington. And there are other things happening outside of Ontario that I would also encourage people to investigate further. But today, I think Dalia and I would like to provide some background and conceptual framing to help contextualize the important work that groups like OCAL are doing. So today we want to bring you along on our journey and to invite you to consider how two factors, namely precarious citizenship status and the international migration process, may be connected to temporary foreign workers' experiences of health and well-being. So far, we have provided a brief overview of the Temporary Foreign Worker Program and the Seasonal Agricultural Worker Program. We've touched lightly on how conditions related to citizenship precarity and international migration come together to shape the social reality of workers during their time in Canada. Now, you've probably gathered that neither Dalia nor I is a healthcare practitioner. That means we can't help you with diagnosing or treatment or any of the nitty-gritty details related to the actual care and treatment of migrant workers. But what we can do is to provide some context as to how the conditions set forth by the Temporary Foreign Worker Programs meld or mesh with the social reality of workers' lives during their stay in Canada, and how those two things impact temporary foreign workers' health and wellness. So what we'd like to do is to do that on this slide. So as Dalia mentioned in the introduction, a lot of workers are mobile and work in low-wage and higher-risk jobs. Many migrant workers face the same types of risks that these workers face, but with additional vulnerabilities that are important to understand that are related to this population. So we'd like to introduce a framework that talking about leading up to today's presentation, and which we've tried to represent here in this graph on the left. This graphic contains 3 gears that work together that adversely affect the health and well-being of temporary foreign workers in Canada. So most of you may be familiar with the brown gear on the bottom. This gear represents the social determinants of health, the idea that an individual's or a community's health outcomes are not only affected by biological factors, influenced by the social and economic factors of a person's life, in particular the living and working conditions that people experience every day. So the list on the right-hand side are several social determinants of health that we feel directly affect migrant workers, including things like job security, working conditions, and housing, for example. So like everyone in the population, these social determinants affect the health and wellness of migrant workers. However, what we want to get at today is that there are at least 2 other factors that layer onto these more established ideas around the social determinants of health that affect the migrant worker populations in ways that exacerbate this situation, namely the overlapping socio-legal conditions related to precarious citizenship status and the international labor migration process more generally. And we've represented these in the graphic. So the blue gear represents citizenship status. This idea helps us to understand how for many migrant workers, their temporary citizenship status can intersect with the realities associated with precarious and low-wage work. In an element that Dalia will look at in a bit on a future slide. The main takeaway point related to the precarious citizenship status gear has to do with how the continual risk and fear of deportation shapes all of migrant workers' decisions while they're in Canada, related to their willingness to accept poor working conditions and limited access to health and other social services. So as Dalia mentioned earlier, workers are dependent on their employers for their right to be in Canada. So you may have heard of workplace raids that target undocumented workers either here in Canada, but particularly in the United States. But we wanted to share that the process of repatriation is very different in the context of the Temporary Foreign Worker Program, as migrant workers have the legal right to work in Canada. So it's not really a process of workplace. A CBSA officer enters the work, as happened in certain situations. Rather, the fear of deportation stems from the reality of employers and consular officials working together to have a particular individual removed from the country for pretty much almost any perceived transgression with no process appeal from the workers' side. Like other workers who are Canadian workers or permanent status, if migrant workers lose their jobs, they can't just find a job elsewhere. So it's well documented that workers will not want to report health and related concerns for fear of premature. This is a situation known as quote unquote medical repatriation that Dalia and I have come across in our work, in our advocacy work, and in our research, and that other scholars in the area have meticulously documented. The green gear represents the international labor migration process more generally. This gear is more related to how the broader social context of migrant workers' lives may affect their health and well-being. It's really important to underscore how the migration process compounds particular vulnerabilities related to the social determinants of health listed to the left of the screen. And we'll look at some of these in more detail in the following slides. But I'd like to say that the main takeaway point is that for workers in low-wage jobs in particular, they're forced to travel across borders on their own and are thus physically separated from their communities and their family support systems for the duration of their stay in Canada. This can lead to unintended and difficult to predict long-term effects, such as, for example, the breakdown of marriages, estrangement from original families, and even the creation of new families while in Canada, which is currently my research, and how these can lead to complicated situations, such as migrant parents overstaying their visas in order to stay united with their Canadian-born children. And this can result in some pretty bizarre healthcare inequities, even within migrant families themselves.
Okay, so following on what Adam just said and building on the idea of the social legal barriers with which these workers have to cope, the first thing is that we have to understand that their employment is subject to a lot of uncertainty. As I said before, initially, employment will depend upon the willingness of the employer holding a positive labor market impact assessment to hire a named worker. What we have to say is that employers rarely hire themselves. The recruitment process will generally be channeled through a recruitment intermediary who will pre-select and assign workers to specific employers according to their requirements. The second step is that once a worker is assigned to a specific employer, Canadian immigration authorities have to grant this worker a visa. And then there's another step, because the worker has to be allowed to enter the Canadian territory. In some cases, workers were denied the right to entry the Canadian territory by the Canadian Border Services Agency, even though they had a visa. This is a prerogative of the CBSA that can stop someone from entering the Canadian territory, even though they have the proper legal documents. The second element is that workers have a fixed term employment. What does this mean concretely is that even with regards to workers that have a permanent status in Canada, job insecurity can make workers more vulnerable. This vulnerability is not unique to temporary foreign workers, but consists in another layer of vulnerability that is coupled with other disadvantages related to the precarious citizenship status. The third point is that the recruitment process in itself can have unintended consequences. Employers from the agricultural sector and from other sectors as well, but in the agricultural sector, it's very specific because employers can hire workers through the seasonal agricultural worker program or the temporary foreign worker program. One of the main differences between these two programs is that the temporary foreign worker program is not an intergovernmental agreement, and that the implementation of the temporary foreign worker program does not require government participation and does not predetermine how or where the workers should be recruited. So concretely, the choice of countries from which employers that wish to recruit through the temporary foreign worker program is a result of strategies that are generally set forth by private labor suppliers contracted by the employer. These private labor suppliers generally work in pairs, one operating in the sending country and another one in Canada. Research shows that workers must pay the recruiters various expenses and fees and will often have to incur a debt to actually pay these fees, and that the fees and debt that are often incurred throughout the process are likely to impact on the strategies deployed by the temporary foreign workers once they're in Canada. Data shows, and that's a long-standing research shows that temporary foreign workers often self-discipline and adjust their behavior to ensure the continuation of their employment. Temporary foreign workers often wish to comply with the expectations, real or perceived, of employers or recruiters. Temporary foreign workers will often internalize that they must behave in a certain way if they wish to keep their jobs. In this context, and if temporary foreign workers are highly indebted, it is very unlikely that they will voice their concerns, their health concerns, because in their eyes, that will jeopardize their employment. The fourth element is that workers will often, while in Canada, will often work very, very long hours and very shortly after their arrival in Canada. They will receive minimal training, which enhances their occupational risks. The last element that I want to point out here before passing it on to Adam is the access to health services. One direct vulnerability related to workers' precarious citizenship status is related to workers' fractured access to provincially funded healthcare. Each province has their own regulations around workers' access to provincial coverage, and it really differs a great deal from no restrictions in Saskatchewan and to provinces like Alberta, where seasonal workers with visas of less than 1 year are excluded and must purchase private insurance. Workers also have a very fractured access to occupational health and safety coverage and workers' compensation.
Thank you, Dalia. So social exclusion, or what I've called social isolation on this slide, is generally understood to be a social determinant of health in its own right. But when compounded with the vulnerabilities related to precarious citizenship and migration, this is a factor that greatly exacerbates the risk to health and well-being for migrant workers. The overarching problem that shapes workers' experiences of social exclusion is their relative disconnection from their home communities, or their communities of origin, and from their families and extended their immediate families and their extended families. So while workers continue to have an important continue to have important transnational relationships with spouses and children, particularly through phone calls and remittances and that kind of thing, their everyday lives in Canada are generally experienced as disconnected individuals. Family separation is a great asset to industrial production, say in agriculture, for example, as workers have fewer, if any, family and community obligations and thus can work longer hours. The need to support extended family in the country of origin through remittances can also add added stress to make more money and thus contribute to workers' willingness to accept below par working conditions. And all of these things come together to increase their risk for injury and also further isolates them from access to important assistances such as with healthcare. Individual workers are also socially excluded often from the communities where they live in Canada. Workers are often sent to parts of the country where there may not be an established diasporic community. So they may not be able to make those types of connections while they're in Canada, and also in areas where there's not a lot of infrastructure to support international in-migration. So they're not going, oftentimes low-wage workers don't necessarily end up in bigger cities, but rather in smaller rural or isolated communities. Workers are often also typically geographically distant from town and are reliant on self-propelled, such as bicycle or employer-provided transportation to meet their daily needs, such as groceries or laundry. So being far from town also means that workers have to find creative ways of getting off the worksite during their time off. And cycling accidents and high-profile road accidents are a major risk, as I mentioned earlier. So workers who work in fields, as opposed to greenhouses, such as in Leamington, are even more remotely located typically, and thus have much less access to health services and transportation, and are thus even more dependent on their employer than our greenhouse workers, for example, who typically live closer to town, such as in Leamington, for example, or in St. Catharines, Ontario, thus exacerbating the precariousness of their citizenship status. So, for example, I worked for a while in the tobacco region near La Salette, Ontario, and during harvest, it wouldn't be unusual for workers to work upwards of 70 hours a week. The nearest town, which was Simcoe, was over an hour away by bicycle, which meant that most workers would not leave the farm property for weeks at a time, except for maybe the quick grocery trip to Delhi, Ontario, that was provided by their employer. So not having access to places to congregate can also exacerbate tensions with local communities, and some towns have considered passing strict no loitering laws to prevent groups of workers from congregating on sidewalks during their free time, forcing workers still further into isolation. Which brings us to the final issue related to housing. SAWP workers, for example, are most often housed in trailers or other ramshackle buildings on farm property. And in the case of greenhouse operations, sometimes directly in the workplace. On one occasion, I worked with a group of workers who were housed in a warehouse, and their kitchen and bathrooms were essentially shared with workers who were currently at work. These workers described having to dodge forklifts on their way back from the shower, for example. The result is that workers feel like they are always at work. The current data suggests that migrant farm workers work between 60 to 80% of their waking lives in Canada, but the housing situation would suggest that what little free time they have is also literally spent in the workplace. So the point that I want to make here is that while many people in Canada, including immigrant workers and other mobile workers, experience negative health and wellness outcomes as a result of social exclusion, for migrant workers, the additional layer of having migrated internationally with temporary citizenship status can greatly affect how social exclusion is experienced. These factors are things that health practitioners must take into account when coming face to face with a migrant worker patient. And so we just wanted to share this as a resource. So you can take this directly from our slide deck. This is from the International Office of Migration, which is the migration unit of the United Nations. And they actually created this really helpful graphic called Migration as a Social Determinant of Health. And it shows the different ways that the migration process can cut across the social determinants of health in some very complex ways, but it's actually a very simple graph that you can take away with you. We're not going to talk about all the different parts of it today, but we just wanted to provide you with a resource, so it's there.
Okay, to conclude and to look at what's ahead of us, we'd like to point out that if most of the research fleshes out the reality of temporary foreign workers coming to Canada through the Seasonal Agricultural Worker Program and the Temporary Foreign Worker Program, we find important to signal that an increasing number of workers integrate the Canadian labor market through what is called the International Mobility Programs. This program has a range of subcategories, but as an overall figure in 2015, there was almost 400,000 permit holders through the International Mobility Program. One specific stream of this program is the Experience International Canada stream, which is a program designed to enhance, and here I'm quoting IRCC, key bilateral relationships between Canada and other countries and emphasize the importance of improved reciprocity. In 2015, over 100,000 work permit holders came through the International Experience Canada. Now, this is really aimed at young adults, and it foresees 3 subcategories. The first one being the international internship, the second one being young professionals, and the third one being the working holiday visa. So for the 2 first subcategory, the work permit of the workers is employer specific. For the working holiday visa, the work permit is open. So the young adults, the workers, can go work wherever at whatever employer wishes to hire them. Now, what's interesting about the working holiday visa is that the narrative around this program is that it's designed for young adults that wish to live a cultural experience while working here and there to make some extra pocket money. I'll come back to that. Important to say that for these 3 subcategories of the International Experience Canada, employers are exempted from requiring a labor market impact assessment. The consequence of that is that Formally, the mobility of these workers is likely to be more flexible. Even though they do not cope with the same contingencies as temporary foreign workers, the preliminary data shows that they work in sectors such as the service sector, retail sector, and that they also experience very poor working conditions. Very little research is conducted with these groups of workers, but from what we know now, several are using these programs as a gateway to transition to permanent residency. It allows workers to display a professional Canadian experience, which is often an asset for provincial programs and express entry programs. The preliminary hypothesis is that they will accept to cope with poor working conditions and likely impair their health to secure their pathway to permanent residence. We believe that the socio-legal context of these migrants, as well as their health and wellness risks, should be further studied, considering that the number of entries for these emerging programs and initiatives are no longer marginal. Thank you, and I will pass it on to our discussant, Santiago Escobar.
Hi, everyone. It's a pleasure to be part of this webinar. So I have a couple of questions for the presenters. Migrant workers are included under provincial or federal compensation insurance programs, whether workplace safety or otherwise. How does their temporary legal status impact their ability to access these benefits?
So Santiago, just to make sure we understand your question adequately, you're talking about the access to workers' compensation and occupational health and safety, am I correct?
Yes, and basically another benefits such as employment insurance and Canadian pension plan.
Well, first, thank you very much, Santiago, for your question. I feel very relieved by your question because this is actually my field of expertise, the access to labor rights and labor standards, but it does pertain to how the health and wellness of temporary foreign workers, and maybe in your case more specifically agricultural workers, can see their health and wellness impaired. So my research and my work has been done mainly in Quebec, and I know that the situation varies from one province to the other, so we have to keep in mind that labor law and labor standards are provincially regulated, which means that the nature and scope of access to labor rights will differ from one province to the other. Now, as it's in the case in Quebec and in other Canadian provinces as well, there is no difference based on the citizenship status that you have access to workers' compensation. From a formal perspective, there's no difference. You should be able to access the workers' compensation regime or occupational health and safety rules, as well as someone that has a permanent status. That's the formal rule. That's what the law says. Now, the discrepancy is what we tried to flesh out in this presentation is between the formal rules and the actual effective access to these different regimes or sets of standards. I think one of the main points is what I have pointed out to is the lack of training for occupational and health and safety issues. I think one of the main points, there's a lot to say, and my colleague Catherine Lepel will be talking about this in the further webinar, I believe, later on this summer. But one of the main issues is the lack of training that these workers have. So they come to work very rapidly. They work very long hours. They'll be in contact with various chemicals. They can impair in a very important way their musculoskeletal health. So the proper training is an issue, and then the other issue for these workers is also, as Adam pointed out, the language barriers. So basically, if they have a problem, who can they address? How can they address it? How can they state it in a language that everyone can understand? So that's from the perspective of the workplace in itself, and for occupation, health, and safety issues. Now, for the access to workers' compensation regimes, if a worker does face an illness or does face an occupational disease or after an accident, one of the main problems is once the visa and the work permit is over, the worker will be going back home in most cases. What if the symptoms appear while the worker is back home? How can he file a claim? How can he follow up on the medical requirements that such claims require? And does the worker even know about the workers' compensation? So I think there's also an important knowledge issue that comes into play, but also the fact that the worker is not physically in Canada anymore or in the province where he was working will also impair his ability to actually access the workers' compensation regime. So I tried to go around. I'll pass it on to Adam.
I think, yeah, thanks, Dalia. And I think just in terms of your question, just the second part of your question had to do with some of the federal programs, right? So those are also programs that workers technically would have access to, I would imagine. So, the example you gave was employment insurance and Canada Pension Plan. Now, in employment insurance, I know USCW has done a lot of work on this over the years. To have make sure that migrant workers have the ability to collect employment insurance. It's a very, very fraught issue, as you can understand, because with regards to seasonal agricultural workers, they are seasonal, and so in theory they should be able to access employment insurance. The problem arises when they are not available for work in Canada during the period that they are not employed, which adds a really difficult snag into the process. And as a result, workers typically do not have access to employment insurance benefits. With regards to Canada Pension, Santiago, as you know, I'm sure you do help workers in this area. Workers generally are able to collect CPP after a number of years in the program if they reach a certain age. But it can be a real challenge to actually accessing those funds as workers, once they're finished working in the program, go back to their home countries. So then the challenge becomes an instrumental or a technical problem of how to actually get those funds into the hands of workers who may be living, for example, in a small village where there may not even be a bank in the countries of origin, right? So these are, like Dalia was saying, workers may be eligible for certain things, but then actually finding a way to receive those benefits can be a real challenge.
Okay, excellent. No, thank you for your detailed answers to this complex issue. So I have a second question. Is that I would like to get your feedback on this one. If migrant workers were unionized and they would have the access to freely exercise their rights and join a union, my question is do you think these workers will be able to enforce their labor standards?
That is the million-dollar question, I think, Santiago. And there are examples that we can draw from. For example, in British Columbia, where I think it was in about 10 years ago, the USCW applied successfully to the British Columbia's Labor Relations Board to represent a group of migrant workers, seasonal agricultural workers. So we can draw from that experience to kind of see how the union relationship actually squares in the context of what we're talking about today, which is precarious citizenship status and international migration. So one of the things that research has shown in the case of British Columbia is that when workers do successfully access the union or join a union here in Canada, the fear of deportation does not actually go away. It's actually intensified. So workers are essentially blacklisted often, and that's sort of another way in which the deportation regime takes place, is that workers are actually blacklisted from the program for actually having joined a union or being a part of a union. So the challenge then, Santiago, is, when you have individual workers who are being blacklisted from the program for having joined a union or being involved with the union, then the question arises of, well, that's a whole new set of questions about how the union could actually work around those types of problems. And that's actually a question that I have for you. I don't have the answer. I just know that, the complexities of deportation, of precarious citizenship status and international migration, those broader complexities don't necessarily go away once workers do have the right to join a union. So it's very complex.
So maybe just a few words on that, because I just so for the audience to understand the context in which this question is asked, I think it's important to understand that in the past years, specifically in the context of Quebec and Ontario, the certification rules now differ for agricultural workers and other private sector workers, and they have a special regime that applies. It's a special certification regime that applies in the agricultural sector that has not shown to be very effective in terms of numbers of units that are actually certified. But I would like to speak about some rules some experiences that we've had in Quebec before the new regime was put into place a few years ago, where unions did reach certification and collective agreements, specifically in greenhouses. That was the sector that in Quebec was in the agricultural sector, the most unionized. And what was witnessed then? So I think we have, building on what Adam said, I think there's two different stages that require our attention, drawing on Santiago's question is, yes, for the certification process, while the workers are in the process of getting a certification, there's certain issues about fear and possibility about deportation that, yes, has to be taken into account. But then once the certification is reached and the collective agreement is actually also reached, what has been documented in the Quebec context is that in unionized workplaces, union representatives that are actually very integrated into the workplace, that can speak the language of the workers, will actually be able to be very good representatives to the workers and actually accompany them in different settings. First, yes, of course, and foremost for the implementation and the enforcement of their labor rights, but also for other issues, talking about heat strokes. Let's talk about the number of hours we work. Let's talk about our weekly rest. So different issues that slowly were not initially integrated into the collective agreement, but slowly came into the conversation with the support and help of the unions, was perceived very favorably on the part of workers that have seen, in their perspective, and this is research from a few years back, have seen in their perspective their general conditions while in Canada, employment and health and wellness conditions improved.
Thanks, Dalia, and thanks, Santiago and Adam, for that. So I've got two questions. It's Barb here again. So the first question we have is, do you have any idea, and this follows, I think, quite nicely from the conversation that you've been having, do you have any idea about the kind of interventions that need to be in place in order to improve temporary foreign worker conditions and access to their rights in Canada? Are there any successful programs? So that's question number one. I don't know if Adam or Dalia want to pick that one up.
So I will just refer to and I think, yeah, absolutely, I agree with Dalia, and I think there have been a lot of union-based and community-based initiatives over the years that have really helped to improve temporary foreign worker conditions on the ground, but that have also played a major role in advocating for changes at the macro level to varying success. So there's a long history of that in the Canadian context. And so with regards to health and wellness specifically, I would say I would go back to reference OCAL, which is the group that I referenced in the presentation. They actually grew out of a social movement context. And so their work with migrant workers is very sort of, it comes out of those values. And I think one really important initiative that has been done in specifically with agricultural workers in southwestern Ontario has to do with the use of mobile clinics where doctors and other healthcare practitioners actually work together with advocates and the union on the ground in order to make sure that workers have access to adequate healthcare that is accessible. So meaning in the language of service, but also where it's located. So in an area of town where workers would congregate, and also, for example, in the Union Center in Simcoe, which is where we have them, I think, on Friday nights when workers come in to do their groceries. That is a hugely successful program, and I think has a huge ability to access workers that don't normally have access to either social movement advocacy or healthcare practitioners through the hospital. So those types of community-based programs are hugely influential, and it's a direction we should be going.
Thanks, Adam. Dalia, I'm going to put the second question on the table, and maybe you can, because we're running out of time, so you can choose to what you want to respond to. So the second question is, in your opinion, how can this lack of knowledge around workers' compensation be addressed?
I think I can answer both questions at the same time, because I think one feeds into the other and vice versa. So I think there's different initiatives that have to be thought of, as Adam said, at the, I guess, macro, then meso, then micro level. And I think it's very interesting. I'm going to just say this because I think we have to often be very, very critical of how some programs or some initiatives are deemed to be very positive. So a lot of the international literature has pointed out to the seasonal agricultural worker program, which is a bilateral agreement between Canada and various countries, to be a best practice that we should follow. Well, when we look at the Canadian experience concretely, what happened, it doesn't kind of follow that definition to be a best practice, and notably for the different reasons that we've pointed out to, the permanent status, the fear of deportation, and other issues, access to healthcare, etc. So I think what the answer to what is the best practice is a very hard one to understand. I have a hard time trying to conceptualize a temporary migration program that would be ideal, but I think we have to ask certain questions as for why don't we consider to grant some of these workers a permanent status, considering that several of the sectors in which these workers are integrated in, it's not a temporary labor shortage, it's permanent labor shortages. And the example of the agricultural sector is an excellent example. The agricultural employers heavily rely on temporary foreign workers to actually function. So why aren't we considering to grant these workers increasingly a permanent status? So there's a question there at the very macro level, and then I guess at the meso and even the micro level, to answer the question of the lack of knowledge around workers' compensation, and I'd say even more largely, I'd answer the occupational health and safety measure. I'd say, well, we always have to remember that occupational health and safety issues is an employer's responsibility, and they have to take the means to actually train their people adequately and give them the tools of interventions to prevent occupational risks. And then when a disease or an accident actually happens, how are the workers actually how are they accompanied to actually file a claim? Can they speak to someone that speaks their language inside the system, not only the health system, but also the actual workers' compensation system? So we have to have structures inside our structures that are able to accompany these people, that means that are sensitive to the several realities that we've pointed out to, such as the linguistic barriers. So there has to be a sensitivity inside our systems to grant greater support to these workers that don't face the same barriers as workers that speak the language, live here, know about the institutions. And the other thing I'd like to point out to say is that several agreements exist between Workers' Compensation Board, and other countries, European countries and other countries, for a worker that goes back home after an occupational accident. Well, those agreements should also exist from countries where low-wage workers come from, and to consolidate these agreements and to make sure that once they're back home, if that's their wish, if their wish is to go back home to their family and they do not wish to stay here permanently, which is perfectly fine, that they are actually able to access the benefits that the workers' compensation system offers if they were still be in Canada.
Thank you, Dalia and Adam, for raising those excellent points. A huge thank you for this very informative webinar. Thank you for sharing your expertise on the different categories of temporary foreign workers, as well as programs that allow them to access the Canadian labor market, and for shedding some light on the challenges temporary foreign workers face regarding their social rights in Canada and the impact this has on their health and well-being. Thank you, Barb, for moderating this webinar and for your active contribution into the Health and the Mobile Workforce webinar series and all the hard work this involves. And thank you, Santiago, for your pertinent interventions and your very interesting questions and your time.
I would like to build on what Delia just said. I would like to add that in Manitoba, as a best practice, I would like to share this example that through a collective agreement in a meat plant that is part of Maple Leaf Foods. So in this plant, we were able to negotiate a clause when migrant workers come to the plant after a year, the company will sponsorship. So throughout this program, basically about 3,000 migrant workers have been able to get access to permanent residency. And it's been proven that is a win-win for the workers themselves, for the employers, for the community. And I wanted to share this example. And we
Thank you, Santiago.
Yes, excellent point.
Highlighted and shared this example with the government.
Thank you.
Thank you so much, Santiago, for this addition. That's great to know. Thank you so much. And then finally, a special thank you to our audience for your participation and for your attentiveness. Immediately